The stalemate over devolving the pay of health workers that has seen the national government and county governments on one side and the health workers on the other, and that has seen the collapse of healthcare in the country, seems far from over. For the last 7 days, the health sector has suffered as workers rooted for a delay in devolution of health services to the counties until a health policy is formulated. But the national government has remained firm that there are appropriate laws to transfer the health services from the central government.
We cannot halt the devolution of health because it is contained in the 4th schedule of the Constitution. Secondly, if you establish a health service commission, it means that you are centralizing the HR function, which as per the Constitution has been devolved.
After a 6-hour closed-door meeting that involved over 15 governors and the Health Cabinet Secretary, governors have remained bullish over the health workers' strike, terming as unreasonable demands by the medics. They have threatened them with the sack if they do not resume duty.
Those who will not have reported to work since the issuance of the court order dated 11th December 2013 will be treated as having absconded their employment by both the national and the county governments.
The leaders of the county government have also indicated that striking workers will not be receiving their pay for the days they have absconded duty, further complicating the standoff.
No salaries will be paid to persons who have absconded from work. County governments are now putting in place mechanisms to hire health personnel to offer services in the county governments.
Already, Nairobi City County Governor Evans Kidero has sacked striking workers in Pumwani, Bagathi and Mama Lucy hospitals and directed the county public service boards in the county to advertise vacant positions for 60 doctors, 436 nurses and 20 lab technicians.
We advertise in all the papers today, and people with qualifications don't need to send applications. Let them do the applications and report to the hospitals in the morning.
But even as the national government distances itself from taking back the devolved sector, the Commission on Administrative Justice is calling on the national government to reconsider the decision of entirely devolving the health services.
The Constitution did not and does not require devolution of all health services. And so it bears mention that whatever decision was made to devolve health services almost entirely is not based on the Constitution. It is a policy decision that perhaps was taken by the national government.
Commission Chair Otiende Amolo argues that the move to totally devolve the services to the counties is a policy decision but not anchored in the Constitution. Besides the exchange of